Let's build our own emergency drug kit. First thing we're going to need is the drug box. We don't need to get fancy here. We just need something to put all the medications in and something that we can transport and get to a patient quickly when needed. You can go to Walmart and Target and buy a small tackle box. You remember from the previous video, we utilized a plastic tackle box with dividers. Generally, we can pick one of these up, very inexpensive, $15. If you want to get something larger with more space, or if you're providing advanced cardiac life support in your office and you need more medications, you can purchase one from a surgical supply house. Here's our emergency drug box. Let's move on to the medications. We're going to highlight 3 medications here, the medications we would use in the event of an anaphylactic type reaction or allergy. Our first medication we want to have in our drug box is epinephrine. Epinephrine is the medication that we're going to use to treat an anaphylactic reaction in our office. Clinically, anaphylaxis can be defined as an allergic reaction involving 2 or more of the following organ systems. You'll see on the right here, we see somebody with swelling to the lower lip, swelling to the tongue underneath that as well. Your initial signs for a cutaneous reaction in anaphylaxis is going to be swelling. Usually it'll be manifested in the oral and neck region with tongue swelling and possibly impending airway compromise. So what makes anaphylaxis so dangerous is how quickly this can occur and how quickly the airway can become compromised. We can have respiratory implications. This would be difficulty breathing, bronchoconstriction. We can have cardiovascular issues, namely a decrease in blood pressure and a significant decrease in blood pressure, or what would be called hypotension. Or you can have gastrointestinal issues as well. This was from an allergen, something that is ingested. Usually it would manifest as diarrhea or nausea or vomiting. But epinephrine can be clinically defined as a reaction involving 2 or more of these organ systems. So if you gave somebody local anesthetic and they've got significant lip, tongue edema, as well as difficulty breathing, most likely we're dealing with anaphylaxis. If you use local anesthesia in your dental office, the manufacturer's product recommendation insert recommends you have epinephrine and bag valve mask positive pressure ventilation available to manage allergic reactions. So, if you're given local anesthetic, you need to have epinephrine in your office. What are epinephrine's effects? We have the alpha agonist effects, alpha 1 agonist. So this is shrinking of swelling and vasoconstriction. The beta 2 agonist action, which is relaxation of bronchial smooth muscle. Beta 1 agonist action, which is basically increase in systolic blood pressure. So if you look over here on the right side, if you give somebody epinephrine, we're going to stimulate beta 1 receptors in the heart to increase the heart rate and help with the low blood pressure. We're going to cause shrinking of mucosal tissues and shrinking of vessels, so that would help our edema issue. That's the alpha 1 response. And for lung issues, we're going to cause bronchodilation. That's the beta 2 response on these adrenal receptors, so we're going to help somebody breathe. What's our dose for epinephrine? Our dose is going to be 0.3 milligrams for adults, or 0.3 cc's, and 0.15 milligrams for children, or 0.15 cc's. We're going to be utilizing an ampule of epinephrine here. Remember, we're focusing on putting our emergency drug kit together with medications we're going to be able to use quickly, but also we want to do this inexpensively. We're going to talk about the EpiPen in a later part of this video series. The EpiPen is very expensive. We want to be able to put our kit together quickly and have something that we're going to be able to use. Using a vial of epinephrine and drawing up the medication may seem a daunting task right now, but we're going to break it down and make it much more simpler for you. Here's a single-dose vial of epinephrine in a strength of 1 milligram per 1 ml, or 1 to 1,000 concentration, and below you'll see a 1 cc syringe with 1.1 increments and a 25 gauge needle, roughly 1 inch on top to 1.5 inch on the bottom. These are our 2 ingredients we're going to need for our emergency drug kit. We're going to need an ampule of epinephrine, and we're going to need a 1 cc syringe and a needle. We'll go through how to obtain this. Very quickly, though, if we had an ampule of epinephrine, we would break the ampule. It breaks at the neck. We would take our 1 cc syringe with the needle, and we would draw up 0.3 cc's of the medication. That's what we're depicting here in the lower right. Any side effects of epinephrine? Generally, if this medication is given intramuscular, which is what we're going to review, the side effects are very small. It's very safe. Patient may have an transient elevated blood pressure, elevated heart rate, nervousness, and shakiness. If you're going to treat somebody for anaphylaxis in your dental office, or you need to, you're going to need to contact 911 as well. These patients generally require observation. Sometimes the allergic reaction can remanifest itself later, commonly up to 8 to 10 hours, possibly. So here's our epinephrine for our emergency drug kit. And remember, we're not using the EpiPen. We're going to buy a vial of epinephrine, a 1 milliliter ampule. Roughly, we can purchase this for about $4, and we can buy a box of syringes with the appropriate needles for $10. Put them in our drug kit. Next up, Benadryl. Diphenhydramine. This is a medication that we're going to use to treat rash or urticaria, our minor allergic reactions. So if anybody is given a local anesthetic and they start developing hives and itching, but not accompanied by orofacial swelling, difficulty breathing, low blood pressure, we're going to be able to treat this minor reaction with Benadryl if we need to. A lot of these reactions generally can be just allowed to run their course. Again, usually these do not involve tongue or throat swelling, and there's no impending anaphylaxis. Remember, Benadryl is a histamine 1 blocker. It mediates cutaneous or skin events, the itching or rash that occurs after drug administration, such as local anesthetic. For our purposes, we're just going to buy Benadryl, and we're going to have the oral form. We're going to have the oral tablets. The dose we would want to give is 50 milligrams as an oral dose. The time to reduction of histamine flare with this oral dose roughly is 80 minutes. So that's the 50% reduction of the histamine-induced flare. If we felt confident, we could purchase Benadryl as an injectable form in 50 milligram per 1 cc vial. We could draw that up and give that for an allergic reaction. We'll see here that the reduction in histamine would occur quicker with an IM injection. For our purposes and for our office, we're going to buy a box of Benadryl, 48 tablets in this particular box. Usually these tablets are 12.5 milligrams. We would need to give our patient 4 of those to equal 50 milligrams. A box of Benadryl is roughly about $5. We'll add that to our kit. Last, for allergy anaphylaxis type issues, is albuterol. We need to have an albuterol inhaler in our office. Many patients have asthma symptoms, in particular the younger patients. When a patient has an asthmatic episode, they're going to have difficulty expiring, difficulty getting air out. This is called bronchospasm, and again, it's due to an asthmatic episode or allergic reaction. Our treatment is the albuterol inhaler, which is a selective beta-2 agonist. It's going to relax the smooth muscle of the alveoli of the lungs. Patient would use 2 to 3 inhalations about every 2 to 3 minutes. Sometimes we can use a space chamber, which is a way to minimize coordination between inhaling the medication from the meter dose inhaler itself. You just squeeze the meter dose inhaler. It becomes aerosolized in this space chamber here down the lower right. All the patient has to do is breathe in. This is useful for young patients. You don't necessarily have to have this in your drug kit. Just wanted to be thorough with what is available out there. Epinephrine can be used for an asthmatic episode. However, this would be somebody with a significant asthmatic episode, and more likely somebody who was having any type of IV sedation or general anesthesia. So here's our third medication. Here's our albuterol inhaler. This is an 8.5 gram albuterol inhaler, roughly $45. We're going to put that into our emergency drug kit.